Okay, I guess we'll go this way. Okay, Vincent van Gogh. Hopefully, most of you have heard of Vincent van Gogh. I'm sort of got into studying him years ago, and it's a gift that keeps on giving because there's so many theories and myths about him. If you understand him, you understand a lot about different artistic styles. I have a little bit of a art history background, although I'm certainly not a professor in art history, but I find it so fascinating. And I was, let me go to the next image. I decided to talk about Vincent from maybe a novel approach, and that would be trying to present him as if he were presenting to us in the ER. I read a lot of articles over the years from different art historians, some physicians, and some other folks who think they know a lot about medicine that have a lot of theories of different medical problems that Vincent may have had, but they don't ever really approach it the way we usually approach it with a differential diagnosis. They latch onto one diagnosis and, you know, stay the course and argue that case. And that's not the way we work. Of course, our way is going to be the best way. So let me just talk about Vincent. Vincent van Gogh lived from 1853 to 1890. It is Christmas Eve, 1888, and Dr. Felix Ray is the resident at the hospital at the time where Vincent presents. He is, and it's a true story, different accounts of he's an intern, first year, chief resident, I'm not sure, but he certainly wasn't the attending. Of course, it's near the holidays, so the resident has to do a lot of work. A patient comes in, presenting with chief complaint of a severe razor wound to the left ear. He's agitated and delirious. He's a 35-year-old white male complaining of significant bleeding and pain after a self-inflicted wound to the ear. He is agitated. He's a poor historian, and he intermittently refuses to answer questions. If you are not looking at a picture, this is a self-portrait of himself after a month or so after. The way he presents sounds like a lot of other patients that I've seen at university, kind of agitated, and when they're first in the ER it can be that way. He was found down at home after an alleged confrontation with his roommate, and then subsequently cut on his ear, cut most of it off. He's accompanied by the innkeeper and the local police. The people around him state that he's been drinking to excess, where he lives in the yellow house. He is often verbally abusive. He's known to have episodes of ranting, gibberish, and he's been paranoid of poisoning. There are also some reports from some of the women in town. This comes from letters later after he's released from the hospital, but some women claiming that he's been inappropriately advancing on them and touching them in shops and so forth. I'm going to digress here for a second. I don't want to run through this just like it's a medical exam. I want you guys to not try to not learn a whole lot, but look at some good paintings, some cool paintings. And this is one of my favorite self-portraits. He did a lot of self-portraits during his life. But in this one particularly, he has, and he wrote about this in his letters, he has particularly almond-shaped eyes. He was at that time heavily into Japanese prints, which a lot of people at the time were, and he was he really wanted to go to Japan and study there. This is a little digression. This is one of his works as a copy of an original Japanese work. He kind of copied the bold outlines and the kind of flattened perspective, the bold colors, the kind of more simple compositions of Japanese art. So that's not going to come up a lot in this presentation, so I just kind of threw that in there. Another digression, he did a lot of self-portraits. On the left at the bottom is Gauguin, his roommate, Paul Gauguin. Lived with him in the Yellow House for several weeks, few months. We'll talk about that a little bit later. And then on the right is Émile Bernard, his other really good friend who was still in Paris at the time, who they were corresponding with. And he challenged those two artists to do portraits of each other. But Bernard on the right he was like 20 years old at the time, and he was he was intimidated for doing so. So he said, well, I'll do a self-portrait and do a sketch in the background. So anyway, just a little digression. Okay, back to the emergency room. On further questioning as to why he cut his ear, he replied that it was an entirely personal affair. Throughout this talk, I'll be referencing a lot of letters and different things, different pieces that I got from a lot of different sources that are listed at the end. But that's what he had to say about the episode. It was an entirely personal affair. Fortunately, we have a lot of correspondences from him through the years, hundreds, thousands of letters that he sent. He was a prolific writer. He wrote to everyone. And coming to think about it, it's like he was texting. They were writing letters like the way we text, and he was a texter. So we learned a lot from him because he wrote everything down. Anyway, so we know a lot about him. The patient's been known to lick his paintbrushes and just paint. There's been reports of him drinking turpentine and drinking kerosene. Just as a note, I am taking a lot of liberties with this presentation because those actually happened later. But, just to make it make sense, I'm putting it all in the H&P. He's been chasing doctors around the ER, and he's following nurses into other patient rooms and refusing to leave, which I've seen plenty of times at university, so that's not new to me, probably most of you. Review systems. He had a lot of complaints. Again, these come from letters, mostly to his brother, Theo, or Teo. I'm going to mispronounce everything just as a warning for those that are art historians. I don't speak French, and I'm from Kentucky, so I'm just going to say him the way I'm going to say him. So Theo, let's call him Theo. His brother Theo, he wrote a lot to, and he complained through the years of these things. Visual hallucinations, he had blackouts, he was irritable. There's a lot of accounts of quote unquote fever, and I'm not sure, there's a kind of mixing of terms that I found, and fever sometimes meant more like agitation rather than fever, or overexcitement, quote unquote. So I'm not sure. Fatigue, poor dentition, mouth sores, dysphagia, and he was obsessed with his roommate Gauguin leaving. So a little bit more to the story then before I go on to his past medical history. The story of how he cut his ear was in an argument with Gauguin, who he had lured to Arles or Arles, to the Yellow House, as a way to start an artist community down there. And that was his dream. Only those two were the only ones that were there. So Gauguin, they had a lot of arguments, lots and lots of arguments about artistic styles and painting, and they just went at each other, and Gauguin was about to leave. So Gauguin, the night of the incident, left their room in the middle of the night, kind of slammed the door, and was going up to the brothels, which they went to every other day together. But Gauguin, or Van Gogh, thought he was leaving, came after him, argued with him, and then went back to his room and apparently cut his ear. He then took that ear. There's several reports of what he did with that ear, or half of his ear, wrapped it up in cloth and gave it to one of the women at the brothel for safekeeping. I can't remember how he put it. Don't have it in my notes here. As you know, for her to keep. Apparently, it was not. There's a lot of stories about that, like that was his favorite, or he thought it was his girlfriend, or was confused. But apparently, it was Gauguin's favorite girl at the brothel. But anyway, so that's the pieces of stories that I've put together. There are other accounts where Gauguin, who loved to play around with the sword, may have cut it off himself, but that doesn't really make sense. It's not really what Van Gogh says to his brother. Okay, this is the doctor, Dr. Felix Ray, a portrait that Van Gogh did after he was released. So, past medical history. Known to have gonorrhea, The Hague in the Netherlands, known to have syphilis and treated by Dr. Cavanaugh. He didn't really like to talk about those, but he did mention many times that he did not like to take any medications, and that particularly potassium iodide, which they used a lot of time back then for infection, he couldn't take because it made him feel awful. He had dental extractions, he had mental attacks, and a history of depression. Meds, he really wasn't on any. I just list these because we're going to talk about some of these later. Again, potassium iodide for his sexually transmitted diseases in the past. Also mercurials, which was the cure or the treatment for syphilis. Not sure he actually took that, but I listed because he may have. Potassium bromide, he was given. I'm pretty sure was given that when he was staying at later on in his after this at St. Remy, the asylum. And camphor oil, he loved that stuff. That was a new drug at the time. Use it for everything, infection, and help people sleep. At the time, though, he was probably not taking anything except for he liked to drink a lot, especially at that time. We're going to talk a little bit about the timeline of his life just briefly coming up, but by this time he was using alcohol regularly and to excess. He also used tobacco. We're going to talk a little bit about absinthe later, but that was one of his favorite drinks that he, when he went to Paris, the year or 2 years before, started drinking with the other artists there, and drank to excess. He does frequent prostitutes. We know that because he writes about it, and he is. There's several letters where he writes back to his brother that it's the best way to live for various reasons that he tries to kind of make an excuse for, but it keeps you healthy. He was a landscape painter, let's say. He had a lot of jobs in his life, but really his father was a pastor, and something that he also wanted to do but failed at that miserably. He was also previously employed in various art galleries, the Goupil art galleries, which he started working at when he was 16, and worked at several different galleries, really because he was he was just horrible with customers. He was always fighting. He was really hard to handle, so they kept kind of shipping him to the next city. But he ended up working in London, working in Paris as a young man in these art gallery, art shops where they sold paintings and prints. But he was well known to argue the customer's taste with them, and however, learned a lot. He's been homeless. He is primarily supported by his brother as a painter at this point, as he has not sold any art. Okay. Family history. On the left, we have his father, Theodorus Van Gogh. They called him Doros. Also, there is his sister, Lies, and his brother, Cor. Anyway, his father had a stroke, profoundly affected Vincent, age 63. His brother, Theo, or Teo, when I discussed earlier, his younger brother, he will have disease and tertiary syphilis, the heart disease from the syphilis, and sounds like neurosyphilis too. There is a strong family history of epilepsy, seizures, and certainly a lot of mental illness and suicide. So we don't know if he had any allergies, so I said he didn't have any known medical allergies. His physical, I don't have any of the records of what that was like. I would love to see those records. There are letters from the doctors that a lot of people have read and I've seen, but they don't really talk about that. That would be great to see, but I don't even know if they wrote that down, but I don't have any of that information. So let's say he allowed us to visually inspect, but did not, and allowed treatment of the wound, but did not allow us to examine him. Let's see if I can digress a little bit about this painting. This painting is one of the ones that I saw that really influenced me to put some of this stuff together. It's sort of a haunting image. I think that is his left ear. Was done about a year later, maybe half a year later, in the asylum at St. Remy. He did, after this hospitalization, when he eventually went to the asylum, he did 141 paintings while there, and he was only there about a year. You can tell there's a lot of research done about how many different attacks he may have had. Let's say call them attacks of severe mental illness while he was at the asylum, because most of the time he was completely coherent and did his best painting during that time. However, there are times where you can kind of predict what's going on, because there are four different spaced out periods while he's there where he does very little writing to his brother, which he almost wrote every day, and very few paintings. He didn't really do paintings when he was having an attack, an episode that the doctor called, because for one thing, they took his paints away because he liked to eat them and ingest a lot of things while he was having these episodes. Well, this painting is the only one that we know of that he did during one of those episodes, where he's probably not completely, he's delirious, he's not completely with it, but it's a haunting image to me, and it's one of my favorites. But there was a lot of discussion about this painting at the Van Gogh Museum. There was discussion for years whether this was actually his work or someone else trying to, emulate him. And it was decided, I think it was in like 2020, that this is a bona fide work of Vincent. So just a little tidbit there, kind of an interesting way to look at how his mental illness was progressing by the fact that he did not do a lot of paintings when he was not doing well mentally, and at the same time where he wasn't writing it as well. Okay, this timeline we'll spend a little bit of time on. Again, he was born 1853. He started working very young age at the art dealership as a clerk, Goupil's, and that was his uncle worked there, is how he got that. Worked in The Hague, and then London, and then Paris. He then, after getting fired, moved on, and fired. He tried to go into theology. He was very religious for a short period of time. He studied but dropped out. He did do one sermon we're aware of. He just couldn't handle the academic part of learning, although he's a very smart guy. He translated the Bible. I don't know if he finished, but he was translating the Bible into 4 languages, with each page, marked out with a quarter each, and was Latin, English, French, and Dutch, I believe. And he did every page in those 4 languages. After he dropped out from that, he decided to work as a missionary in the Borinage, which is the coal mining district, which was horrible, horrible conditions there. People died at an early age. They worked underground their whole lives. It was just horrible. And there's a lot I've read about that era and riots and things about that time, but it was just the poorest of the poor, downtrodden, and he ministered to the sick there. Fired from that because he tried to, he kind of overdid it in terms of trying to be kind of emulating the people there by being as poor as they were and punishing himself. He would wear rags, he would sleep on the floor, he wouldn't eat. He just kind of took everything to the nth degree. He then decided that he was always drawing, so he decided he really wanted to move into that world. The family had a lot of art background as well, so he because of the family knowing a lot of artists and having some influence, he got into the academy, probably some backdoor somehow, and dropped out of that. He visited his parents after he dropped out and fell in love with a woman who was rebuffed, left, and then go through all the details, but ended up in Brussels, back in Etten. His father died. He went to Paris, Arles, and then Saint Remy, eventually Auvers, where and then later died. We'll talk more about especially the Brussels, Paris, and Arles times. This is well, it was recently discovered when I started this lecture, but it's not been that recent anymore. But this is actually a drawing that Felix Ray did of where he severed the ear, which is pretty much most of it. And this is actually in his hand. The doctor drew this. He drew it after the fact. It wasn't done, that night, but that's how he showed it. And I kind of translated what I could there. Actually, one of the students of this class translated it years ago. I'm happy to have given you the information that you asked for concerning my poor friend Van Gogh. Please don't neglect to glorify him as he deserves, the genius of the remarkable painter. But then you see in the diagram itself, it says the ear was cut with a razor along the dotted line, and the lobe is the part of the ear that remains. That's my writing on there. That's what we translated it to be. Which, not a big feat, but it's kind of hard when you don't speak French and it's written like that. Anyway, interesting. All right, assessment and plan. Well, he's got a left ear wound, a very big one. So we'll, vaccinate him, monitor him, do wound care. Really, this talk is about a differential for his delirium. And we'll go through each one of these. So I don't need to talk about them here. And let's also put him on some prophylaxis for alcohol withdrawal. We know he has been drinking excessively. Okay, sunflowers. He did a few versions of the sunflowers, and all kind of in a monochromatic way. They have become one of his most famous subjects, and he loved them, loved painting them. This sold in 1987 for $40 million. which was at the time a huge amount of money. Then I have added on the right down at the bottom, really the only painting that we know that he sold for 400 francs during his lifetime. And that was sold just a few months before his death. He did those sunflower paintings in south of France in Arles in 1888, 1889. He painted a total of 5 of them using different shades of yellow. He wanted to create an image with numerous variations of a single color, and he also wanted various stages of life in the flowers, some of them dying, some of them vibrant and pointing towards you. Okay, we're going to the differential. Syphilis. Well, we know he had it for sure, as in, I think I've read places where 25% of the population in Paris at the time did. He had, I'll talk about CN here in a second, but neurosyphilis, common in the pre-antibiotic era. Remember, this is before antibiotics. I can imagine those times. A lot of folks asymptomatic, but symptoms include headache, nausea, vomiting, stiff neck. The words that I have in yellow are things that he complained of that I read in his letter. So aphasia, ataxia. He had all kinds of abdominal pain through his life, lancinating pains. Of course, Argyll Robinson pupils. I don't know if he had that or not. It'd be cool if we did. He had some sensory loss. Later in his years, he said at times he couldn't hold the brush and he couldn't write letters because he just he physically couldn't do it. Interestingly, his younger brother, had similar symptoms that Van Gogh did, talking about delirium. He was much sicker than Vincent, but was also eventually in an asylum because he was not curable and was incoherent. He died 6 months after Vincent did, so it's just kind of a tragedy. CN is a woman that Van Gogh met in The Hague at the time he was there. This is right before he went to Paris. He was with her for several months and actually talked to his family about marrying her. She was a local prostitute, she had, I think, a total of 4 children, not with her anymore. There was one with her when he met her that was about 5, and she was pregnant at the time. He stayed with her for a little while and then left. Really the only significant relationship that he had. And he did several portraits of her. I stuck this painting in just so I could stick this painting in. So if just take a look at the composition, the brush strokes, the perspective. He carried around a perspective frame with him so he could get the angles right. I'm going to read what he wrote about it. If you could try not to read it, just look at the painting while I do. In point of fact, I was interrupted these days by my toiling on a new picture representing the outside of a night cafe. On the terrace, there are tiny figures of people drinking. An enormous yellow lantern sheds its light on the terrace, the house, and the sidewalk, and even causes a certain brightness on the pavement of the street, which takes a pinkish violet tone. The gable top fronts of the houses in the street stretching away under a blue sky spangled with stars are dark blue or violet, and there is a green tree. Here you have a night picture without any black in it, done with nothing but beautiful blue and violet and green. And in these surroundings, the lighted square acquires a pale sulfur and greenish citron yellow color. It amuses me enormously to paint the night right on the spot. They used to draw and paint the picture in the daytime after the rough sketch, but I find satisfaction painting things immediately. In Paris at the time, the Impressionists were influencing him there, and he knew a lot of them and trained with some of them, worked with some of them. He worked with Paul Signac. He worked with Toulouse-Lautrec. He knew of all of the Impressionists and had learned a lot in Paris when he was there. Before coming to Paris, his paintings were darker, duskier, more monotone, depressing. And he really, at that time, in the old days, talked about Impressionism as fluff and silly. But he learned a lot coming to Paris and being exposed to all of those painters. Also, I don't want to leave this painting without, there's some theory, and it's kind of debunked, but I'd like to at least let you know that it exists, that this is his interpretation of the Last Supper by Leonardo da Vinci, because you have the perspective lines that are famous for the Last Supper. There are 12 figures, and even the orange window in the back kind of looks like a cross. Now, I don't buy that, but it's kind of an interesting thing to talk about. If you ever hear of that, he would have certainly described that. There's no way that he wouldn't. So just one of my favorite paintings, so I thought I'd digress and show that. All right. Absinthe. Oh, he loved absinthe. Was popular in France, especially among the painters who kind of hung out in the same places. Also in the art community in Arles, when he moved to the Yellow House in Arles after Paris, where he is during this ear cutting episode, he lived in a building where the first floor was like a little cafe for painters. And he loved to drink. This is a portrait of him done by Toulouse-Lautrec. And you can see, I mean, it's faint, but you can see the classic glass for absinthe in front of him. Absinthe, especially at that time, can cause hallucinations and seizures, especially if you're predisposed to seizures. Also, GI upset, altered mental status, and it can also cause some where you can see yellowing around lights like digitalis does, and we'll talk about that a little bit later. Anyway, there's no argument that he drank it. There's a painting of it right here. There are some, there's a lot of reference to him drinking absinthe, although there's some scholars I've read that really minimize his use of it, and I don't know why, but they don't think that it's a big deal. This is this is one of his still lifes, and on the right is a picture of the classic way they used to prepare absinthe, where they pour cold water over the sugar cube on the little metal thing on top of the glass, and as it dissolves into the liquid, it turns it like a kind of a brilliant greenish, yellowish greenish hue. So it's just kind of a cool effect. We know he drank a lot. Oil of camphor, pinene. Other things that he was exposed to, he admitted to excess doses of oil of camphor. He put it in his bed, he put it in his pillows, he put it on his ear for infection. And you can imagine also in his little tiny room and studio, all of the things that he was exposed to, the toxins. It was a small house. There's accounts of turpentine, paint, kerosene ingestion. He was known to lick his brushes and so forth. This is a painting he did, the bedroom, 1888. Okay, this is the Yellow House in Arles, or Arles, like I call it, 1888, where he enticed Gauguin to try and start a little art community there. It's the famous house, still there today. There's a lot of yellow. I also, and I don't know why, I am always drawn to the sky in this painting. It's unlike a lot of his other skies, heavy like the building, but I just can't take my eyes off it. It's just, I don't know why. It kind of has a characteristic of, and there were a lot of influences later after his death with German expressionism. So I don't know, I can see that there. Mercury, okay, was the drug of choice for gonorrhea and syphilis. It's given as a blue pill or ointment mixed with lard. They did some where they would put it in a hot like hot pan, and then you put a blanket over your head and you just kind of inhale the mercury. So that thinking at the time was kind of the old, four humors, and phlegm being one of them. And if you could get the phlegm out, you were going to help treat syphilis. And so doing that treatment would, kind of make their eyes burn and water and nose, and kind of like an expectorant. So they used a lot of mercury. That was really the only, and potassium iodide, but mainly mercury. Well, we all know about mercury toxicity, inflammation of the gums, increased salivation, which is what it's supposed to do. It also causes intention tremors, excitability, insomnia, nephrotoxicity. The woman here in this painting, this was when he was in Brussels, and she is Gordina de Groot, in her and her family are the subject of The Potato Eaters, one of his early famous paintings. She posed for him, and it's called The Head of a Prostitute. But sometimes that's the only way he would get models. It was cheaper to do it that way and then serve as a model. He did a lot of those type models, and also self-portraits, because that was free. You just needed a mirror. Mercury poisoning, a little bit more, that while we look at Vincent's chair with his pipe. Mad as a Hatter, mercury poisoning was, the hatters at the time would have the classic mercury poisoning because they used it for the felt, for the hats. So you get the hatter's shakes, loss of coordination, loosening teeth, memory loss, irritability, confusion. Gosh, you had a lot of these complaints. Why I'm going over this seemed like he may have had a lot of mercury in his day. Also, there's evidence, and I actually saw this studies, although not written in English, where they think that they were the end stages of syphilis being, tabes dorsalis and those, neurologic issues. They thought that the syphilis was getting worse when actually it may have just been the mercury they were treating him with, so they would give them more mercury. So kind of a vicious cycle there. Okay, let's go to the next talk. So I'm going to talk about lead. There's lots of suggestions that he kind of ingests a lot of his own paints. Whether he was confused or not, he certainly did lick the tips of his paintbrushes to get a finer edge. And then there's reports that he would sit there while he was thinking and looking at his painting, just pondering, where he would just stick them in his mouth and kind of, like a habit. There's detailed sketches and descriptions in his letters to confirm which pigments he used, which contained lead. He used to get his art supplies at Tanguy's shop in Paris. There's all kinds of stories of him licking paint. There's actually a story of in Auvers, there's a boy that kind of, we'll talk about him later, but he kind of is a 16-year-old guy who kind of not torture, but bullies Vincent and makes fun of him and laughs at him and pranks him. And one of the pranks they did was to put hot pepper on his brushes when he wasn't looking, and then when he would lick his brushes, he would get the hot pepper and get really mad, and they thought that was hilarious. So we know he licked his brushes because that's why they pranked him. The point of that story. This is a painting that Gauguin did of Van Gogh, and Van Gogh hated it. It's him doing the sunflowers painting. Van Gogh hated it because he thought it made him look simian, and he thought it was an underhanded swipe at him. They just did not get along. Lead toxicity symptoms, he certainly had a lot of them. I wish we could examine him or check a level, but he was certainly toxic, or certainly exposed over many, many years. Alcohol withdrawal, intoxication, the little debate that he actually drank a lot, although there's a lot of scholars that minimize it. The attacks he had were not often blamed. I could not find that they blamed it really on alcohol withdrawal, or if they knew what that was. Sure they did, or intoxication. But we know that there are a lot of episodes they had that were related to drinking or right after drinking. And what he was drinking wasn't the best thing either. And here's what I'm talking about. Times where he had quote unquote attacks. One time in the Borinage, he really wasn't eating, was probably malnourished, and the Hague when he had gonorrhea. But after that, he had several episodes when, all right, so timeline here, the 1888 is where we are now when he presents to the hospital. He's then later released from the hospital and is back at the Yellow House and has another episode. After that episode, he is committed to the asylum in St. Remy. And he was a level 3, or what they call it. Why do I think level 3? He was something like a level 3 patient where he could come and go. And so subsequent attacks almost always had to do with him coming back from a visit to Arles, which, you can't discount. Whether or not it was alcohol withdrawal or if the alcohol may have, exacerbated other things, it certainly you can't be overlooked. Wernicke-Korsakoff, I threw that in there because we see it or put it in our differential lot. There's really not a lot of evidence of that's the case, or any evidence at all of that. This is a painting of a cafe that he frequented in Paris. This is Agostina Segatori, one of his friends, and also another woman that he fell in love with that didn't return those feelings. She owned a restaurant called Le Tambourine, or the Tambourine. You can see that the tabletop looks like a tambourine, and it was a place that he frequented. Another place he frequented, and I bring this up. I think we're going to talk about the yellow rings around the lights, but this is the Night Cafe, and this is the only one. Or I just started looking at this, but you can hardly see it. It was too faint to see, but right under his signature, he actually titled the piece, which he didn't usually do. But it says the Night Cafe under Vincent in the right lower corner, right under his signature. That's at Yale, by the way. Anyway, the owner of the cafe, Ginot, is standing there right next to the pool table. The other people in the bar, it's late night, are drunk or depressed, and then there are prostitutes in the back. Anyway, this is, we're going to talk about on the next slide, one of the studies where I bring up his use of color, of complementary colors, based on what he had read and seen. He tried to use complementary colors, which are the colors that are crossed from the color wheel from each other, to show emotion, excitement. The colors kind of vibrate next to each other and kind of fight each other. So what didn't matter really what the color in the room was he was painting, he tried to change that to something complementary. And I should have mentioned earlier, but the cafe and the terrace earlier painting, the cobblestones had the lavender, purple, yellow right next to each other as the cobblestones. Are kind of a similar thing. I'll show you in Can't really see it, but you can see that the color wheel there, which was introduced fairly, a few years before Van Gogh started painting, but was very famous, and that was really the first time that these colors that theory had been put forth by Charles Blanc. You'll see him mentioned a lot. But you see the colors across from each other are the complementary colors, the yellow and purple. You can see the green and the red for the painting we just had. And one of his favorite painters he talked about a lot was Delacroix, who made use of that and talked about that in his writings. He had seen a lot of Delacroix. He was in some great cities to see art and spent a lot of times in museums and studied them, and did reproductions of different paintings by memory. So I just throw that in there. Complementary colors. If you see any paintings, look for those. This is one of the Hepatic encephalopathy we'll talk about. But this painting, a self-portrait, 1889. The timeline is he spent time in St. Remy, the asylum, between May 1889 and May-ish 1890. Then went to Auvers under, we'll talk about that in a second, but just a few months after he leaves the asylum, he dies. So this painting, though, I bring up because I looked at this and I thought, this is like one of those liver patients that I've seen so many times in the hospital. It looks like he's got temporal wasting, thin neck, thin shoulders, and upper torso. I can imagine some ascites there, I guess, because of the way he's holding the palette, and hit the color of him in general, kind of dusky appearing, made me think of that. And I looked more into it at the time, and did not find evidence of that really, but I thought it was interesting to look at it that way. There was certainly nobody saying that he was turning yellow or anything in any of the letters. But he did describe some things that may make you think that. He did have, the difficulty holding the brush on some days. Did he have asterixis? I mean, I don't think so, but just throwing it out there. His brush strokes through the years got progressively shorter and linear, repetitive. However, there was never any description of ascites, edema, anything like that. But just throwing it out there. It's in the differential. Liver disease. I need Dr. Cave to look at all the illness. You saw his grand rounds a couple of weeks ago, but brilliant. But he was exposed to a lot of different diseases or different toxins that could have caused liver disease. And then alcohol on top of it. See, I'm running out of time here, so I'll keep going. All right, Dig. Okay, so back in the old days when I was at U of L as an undergrad, I got the opportunity to work at the Speed Art Museum as a docent, a volunteer work I did as a docent. And we had an exhibit, the Arm & Hammer exhibit, that had a Van Gogh, along with a lot of other paintings and a lot of other Van Gogh's influences, like Mallet, for example, or Millet. But I was taught as a docent that those yellow circles around the lights, that's from Dig. Digitalis causes that. And he was on Digitalis because that painting of Dr. Gachet, he's got a foxglove plant that he's holding, which is what Digitalis comes from. So, and that was one of the other things that sparked my interest in doing this lecture, to see if he was actually on Dig at any time, because that's mentioned a lot, and you may have heard that. He was treated by Dr. Gachet for the last several weeks of his life. However, there's no evidence in his letters, and he wrote a lot of letters, that he was ever taking any medications under Gachet. And remember, this was done way, way after Starry Night and the Night Cafe and those paintings. So certainly back then there was no mention of him being on dig. But I'm not saying he couldn't have been, but it would explain why he may have kind of painted halos around lights and stars, and also why he had so much abdominal pain that he complained of over and over. So I put on here, problem is he never took dig as far as we know. And, I don't know, but I'm throwing a little doubt there that he actually did. So just throwing out there that you can also get that from similar symptoms from absinthe. Okay. Okay, so Starry Night, one of his, probably the most famous painting that he's done. So many copies of, including me, that's me, it's a long time ago. I did that Starry Night over Louisville, I did for a charity auction years and years ago. And boy, I'm telling you, it's harder than it looks. So much harder than it looks. To do that type of painting. But anyway, he wanted to describe, this is a sky, he did this painting while he was at St. Remy, and this is the sky over the town. He did not do it at night, but was remembering stars from, you see out his window and so forth, but was trying to depict the stars and the beauty of them the way he saw it. That church steeple that you see was in St. Remy, and I can't remember the name of the church, but St. Remy was a huge town. He made it tiny just for the painting, but it's had 10,000 people or something. So it wasn't really nestled in the hills like that, but he can take license and do what he wants. Macchiafava Bignami, I just added that for fun. It's not something he had. But we kind of had to add some zebras in there. But you can see it. It's very rare, but you can see demyelination, necrosis of the corpus callosum that you can see on MRI with chronic alcoholics, malnourished chronic alcoholics. But it didn't really fit this picture. I added this painting because this is not the way the painting looked when he painted it. I think that we see it, he doesn't look well. And one of the reasons he doesn't look well is because his lips are very pale. He's very pale. And the background is a pale blue. However, the reason for that is because the red pigment he used faded over time. He knew that, but it was the only paint that he could afford or what he could get. There was better paint that he could have gotten. But so that background was a kind of a purple, lavender purple, and his lips would have not been pale because the red has just gone away with time. So I thought I'd mention that. AIP, I mentioned this just because it's mentioned so many times in other literature. One of the other reasons that I want to do this lecture, as if that, they kind of latched onto this disease and tried to make it fit Van Gogh. And then at the end of it, there's no discussion. That's what he had. And that's not even on my differential. So yeah, some of the symptoms are kind of vague. It occurs in the 3rd to 4th decades, which it did, and that's how old he was, 37, 30, 35. But it's so rare. It's just not that. But I bring it up. That is a picture of him. Bipolar. That is one of the most likely diagnoses that he had. Oh, I'm running late. It was known as double form disease. Gachet certainly knew about it. And he did have episodes of mania and overexcitement, had manic episodes, it sounded like, and he had a lot of depression his whole life. So that's certainly up there in the differential. This is at Eternity's Gate, and this painting's been used over and over in different circumstances. He was also known to sit with his head in his hands a lot. By the way, it's described that way. Schizophrenia, a lot of people think that's what he had. I personally don't, because he did have attacks where he's delirious and not responding, and having hallucinations, but they always got better. And did not, his letters were certainly coherent at all times, except I'm learning some the last couple months. His last couple letters, they did make sense, but his brother was confused by them a little bit about the things he was saying weren't exactly true. So, but I don't think he had schizophrenia. This is one of my favorites. This is the irises. It was painted at St. Remy at a low angle, which was kind of weird to paint that way. But this is just beautiful. They're so heavy and colorful. Meniere's, this is another one that's proposed. He cut his ear off because of the tinnitus. He did have some nausea sometimes, and this was proposed by a quote-unquote ear specialist. I don't think it was an ENT doc that wrote the article. I can't remember, but I really don't put much faith in that. This is a patient at St. Remy, the asylum. Epilepsy, probably the most likely diagnosis, the way he presents. He did have a lot of descriptions of him staring off into space and licking his lips and not responsive. He had quote unquote attacks. He had a lot of them after alcohol. We have accounts from people that worked at the asylum that sound a lot like kind of a, staring off into space. Never any tonic-clonic seizures, but certainly something to think about. And that's actually what they thought he had at the time. So they didn't know much about it, but they compared it to epilepsy. I'm hurrying up because I'm running out of time. I'm sorry. This is one of his last paintings, although it's not his last. We used to think it was, but it's so depressing. So let's just say it is. Wheat field with crows, this dark looming sky. You've got paths going in different directions, the ominous crows. He described it as there are vast fields of wheat under troubled skies, and I did not go out of my way to try and express sadness and extreme loneliness. The sadness will last forever, he said on his deathbed. The actual last painting he did is on the right, which is a tangle of roots. So one day, July 27th, 1890, Vincent took his equipment out to the fields after lunch, like he did every day in Auvers. He then was seen stumbling back later in the day without his easel or any of his paints. With his coat closed, he stumbled up to his room. They went to check on him, and he had shot. He said he, quote unquote, wounded himself or wounded myself. And they noted a pea-sized bullet hole in his abdomen, which he denoted that he did and no one else. I can't remember how he said it, but basically that. Dr. Gachet sent a telegram to Theo in Paris, which is a 3-hour train ride away from Auvers, and came to his bed. The doctors at the time, Gachet and the local doc, were under the impression, although it was not bleeding a lot, that it could have punctured his lung if it was an upward trajectory, but he didn't have a lot of bleeding, and they weren't exactly sure that it was going to be a fatal wound. So they did not put him on a train to Paris, which would have surgeons to take care of him. That's the account that I've kind of dug into, because I never understood why they didn't, it's just a small bullet wound. He eventually succumbed the next day and died, of which sounded like, in all the descriptions, of kind of gasping for air at times and suffocating, the way Theo described it, and in a lot of pain. He did indicate that he did it himself. At the very beginning, he asked them to get the bullet out, but then later, was happy with dying this way. And if he was saved, said he would just have to do it again. They did not find the gun or any of his supplies at the time. This gun was found in that field in 1960. So they think it may have been the gun that he shot himself with. This is the actual obituary. of him wounding himself, killing himself. This is where he is buried. So sad. We think suicide. I'm going to say a little bit more of that on the next slide, and then I'll end. So my conclusion is, like a lot of things, I think that, went through differential, and we have some a pretty full differential, but as in most times when we don't know exactly, it's probably multifactorial. He had a lot of toxins through his life. He drank a ton, and not the best thing to drink. But he had several different heavy metal poisonings. He was exposed to solvents, and he also had a long life of depression and obvious mental illness. Don't know exactly the cause of his quote unquote madness, but whether bipolar or some epilepsy, seizure disorder, or something else. But certainly, I think what I want to disabuse everyone of is that is what led to the painting the way he painted, because he was very exact. He also, and I thought about this today, he was exposed to a ton of artists and was friends with them for a short time till they got sick of him. But he worked with them, he learned from them. He learned from Mauve and different artists wherever he went. It was really sort of an apprenticeship. He did study at the academy, but as most artists at the time, they studied there and then painted. He went everywhere and learned from everyone. He was also had an upbringing in the arts as working in these art studios. So he knew the styles. He talked about them. He visited museums. So it's sort of an apprenticeship that a lot of other artists don't really do or didn't do. So that is part of, you take his genius plus all these influences and you get what you get. So probably not related to his mental illness. And if he'd lived another 10 or 20 years, I think we'd still be talking about him. So did he kill himself? You may hear that there's some theories that someone may have killed him. There was like I mentioned him earlier, René Secretan, who was him and his brother on vacation in Auvers. He sort of was a hot shot, kind of a little jerk, carried around a pistol, dressed like Buffalo Bill because he bought an outfit from the Paris, who was the Paris Fair, or the Buffalo Bill exposition that was very popular at the time, the American cowboy. Did he accidentally shoot him? And then why did he return without any of his canvases and paints and nobody ever found him? Seems like somebody may have, hidden them or gotten rid of them. And where'd the gun come from? He never fired a gun. He never had a gun. And there's theories about that too, because the place where he lived had a gun. The guy owned it, had a gun. So who knows? Overall, though, he denied it. He was depressed. Really, the thinking now is that it was suicide and probably not this other theory. Here's my sources. And I flew through that, but I will answer any questions that you might have.